patients might want brand new, bright white veneer type teeth. And typically, when we do veneers, before we do them, we want to make sure that the teeth are arranged properly for those veneers so that when the patient bites down, they're in the proper position so there's no excessive forces that might cause them to fail later on. So one of the things that we'll do is we'll take a 3D impression, a digital impression of the patient's teeth, and look at their bite, look at the relationship between the top and bottom jaw and the arrangement of the teeth. If the teeth are arranged in a way that they're not ideal, and it might be better for them to be in a more ideal alignment for their veneers, we might offer or recommend something such as clear aligners to move those teeth into a more ideal position. And clear aligners are worn 22 hours a day. The only time you take them out is to eat. You wear them all day and all night. But I will add that we now have clear aligners that are worn just at nighttime, and they must be worn 9 to 12 hours per day. And with the nighttime aligners, it allows patients who don't want to wear the clear aligners during the day, just maybe from after dinner time to early in the morning, and still get the job done. So once we have the teeth in the proper position, what we now want to focus on is the level of brightness of those teeth. What are the goals of the patient? Do they just want naturally white teeth, or do they want to go beyond the natural white scale into more of a piano key type whitening? So what we encourage patients to do is to consider doing an in-house whitening treatment where we can get the potential of that whiteness as high as we can get it, and then do the veneers afterwards, so that the teeth we're veneering to are going to be the shade that we choose through our shade guide, but the surrounding teeth will all match. So the process usually goes: first, teeth arrangement. We want to make sure they're in the proper position. Do we need clear aligners? After that, let's get the teeth surrounding the veneer area as white as possible through our in-house whitening technique. Third, once we achieve that maximum level, let's use our shade guide to see where we're at and match that to the adjacent teeth. And that way we get the whitest smile possible.